Hey there, future civil servants. Getting ready for those UPSC exams? Well, you know we've got you covered. Today, we're diving deep into a topic that pops up in both prelims and mains.
Oh, yeah.
The National Health Mission.
Or as most folks know it,
The NHM.
NHM.
It's India's plan.
It's a big one, too.
Yeah, I'm a big one.
For accessible health care.
Quality healthcare, too.
That's right, especially for folks in rural areas and anyone in vulnerable groups.
And it's not just about, memorizing names and dates for the exam.
Definitely not.
Think about it.
Think of the NHM as like this puzzle piece.
Yeah.
It fits into
Public health,
health,
governance,
social justice,
social justice.
all key themes.
Absolutely key themes for your mains prep.
You got it. And trust me, India's got some incredible achievements to talk about.
Oh, they do.
Like significantly reducing
Maternal mortality and fighting diseases like TB.
and malaria head on.
And even starting these community-driven programs, like the Nikshay Mitra program. Okay, so before we get too far, let's set the scene a bit.
Okay.
The NHM wasn't always this huge thing.
Right.
It started back in 2005.
Way back then.
As the National Rural Health Mission.
Focusing on,
rural health care.
Makes sense when you think about it.
Yeah.
The gap between rural and urban India in terms of access.
Huge gap.
Yeah. It was a crucial first step, for sure.
But fast forward to 2012.
Okay.
And the government's like,
What?
urban areas
Uh-oh.
got their own problems.
Totally.
So they
We
said
should bring them together.
both rural and urban.
Under one big umbrella.
The National Health Mission.
And that's important for your exams.
Yes.
That shift.
To include both.
Both is key.
Rural and urban.
Shows their commitment to universal health care.
For the whole country.
The whole country.
Now, a mission this big,
This big.
it's got to have some goals.
Oh, it does.
What's the NHM aiming for?
Well, there are 5. 5 key objectives.
Lay them on me.
First, you got universal access to quality healthcare services.
So no one's left out.
Exactly. Then you got affordability.
Okay.
And equity.
Equity meaning.
Healthcare shouldn't bankrupt you.
Right.
And everyone deserves a fair shot at good health.
Makes total sense.
The NHM also really pushes for responsiveness to people's needs.
So the system's actually, serving the people.
Serving the people it's meant to.
Okay, what about the other 2 objectives?
We've got accountability.
That's a big one.
Huge, making sure everything is transparent and efficient.
Yeah.
And lastly, aligning with global goals.
I was going to say, are we meeting those SDGs?
Specifically SDG 3.
Good health and well-being.
That's the one.
So these goals are really impressive.
Yeah, they are.
But how does the NHM actually make it happen?
On the ground.
Yeah, this is a massive program.
It is.
The logistics must be mind-boggling.
It is a very complex program.
Yeah.
Very carefully structured, though.
Okay.
At the national level.
Right.
You've got the Ministry of Health and Family Welfare.
I should have known.
They provide the financial and technical support.
The backbone.
Even the mission.
But the real action
Where is it happening?
happens at the state and union territory level.
So they get
They have the flexibility
to make it work for them.
adapt the NHM to their own challenges and needs.
So it's like
It's a collaborative dance.
between the center,
and the states.
which is smart
Very smart.
because things are tailored to the local context.
Exactly.
Yeah.
Now for the good stuff.
Let's get to the good stuff.
What has the NHM actually done?
We've heard about these amazing successes.
Oh, yeah.
Tell me more.
One of the most impressive
Yeah.
is how much the healthcare workforce has grown.
Really?
The NHS has been huge
Yeah.
in getting people in and training healthcare professionals,
Especially in those rural areas.
especially rural areas. Just in the last 3 fiscal years,
3 years.
they've engaged over 11 lakh healthcare workers.
11 lakh.
11 lakh.
That's more than
That's more than some countries.
Yeah.
Entire populations of countries.
full countries.
Wow. They're serious about this.
They are.
What kind of healthcare workers are we talking about here?
Well, you've got your doctors,
Okay.
your nurses,
Of course.
and most importantly, your CHOs,
CNHOs.
community health officers.
Okay.
They're the front line
For frontline warriors?
providing basic healthcare services in villages.
Oh, so they're that link
That link
between the community
between the community and the system.
and the bigger healthcare system.
Exactly. They are a cornerstone
Of this whole thing.
of the NHM's efforts to strengthen primary health care.
I see. So it's not just about,
It's not just fancy hospitals.
it's about building that network.
The network at the grassroots level.
And speaking of successes,
Oh, yes.
I know you're dying to tell me about
I am.
India's progress with reducing maternal mortality.
It's a story we need to tell.
It needs to be shouted from the rooftops.
Shout it loud.
Okay, tell me.
Since 1990,
Okay,
India's MMR
maternal mortality ratio.
has dropped by 83%.
That's insane.
83%.
Put that into perspective.
Global average decline was only 45% in the same period.
That's amazing progress.
Amazing.
What's the secret?
It's not just one thing.
Of course not.
A major player is the RMNCH plus A strategy.
RMNCH plus A. What is that?
That stands for
What does it stand for?
Reproductive Maternal Newborn Child and Adolescent Health.
Wow, that's a mouthful.
It is.
But it's a key component
Key component.
of the NHS
It focuses on giving comprehensive care
to women and children.
at every stage, from pregnancy to adolescence.
So they're not just
throwing money at the problem.
they've thought this through.
It's strategic and holistic.
And I'm guessing this focus on maternal and child health
Yes,
has had like a ripple effect
it has.
on other key development indicators.
You're totally right.
Tell me more.
India has seen significant declines
Yeah.
in the under 5 mortality rate,
Okay.
infant mortality rate, and even the total fertility rate.
Wow. So these are all signs
Positive signs.
of a nation's development.
And they're directly linked to better maternal and child health.
It sounds like
It does.
India is making serious strides towards these development goals.
They are.
And the NHM is playing a big role.
Huge role.
But we've only just scratched the surface here.
Oh, yeah.
There's so much more to talk about.
Lots more.
We got to take a quick break.
Okay.
But we'll be back
We'll be back.
to explore more of these NHM achievements
More achievements.
and all the specialized initiatives.
Oh, the specialized initiatives are great.
Don't forget to hit that subscribe button.
Subscribe.
And give us if you're finding this deep dive helpful.
And all this information
Yes.
can be found
Right.
on the Press Information Bureau website.
That's right.
So you can always double check
Double check
all those facts and figures.
for your UPSC prep.
We'll be back in a flash.
We'll be right back. We're back and ready to keep going with our deep dive into the National Health Mission. We've already seen how it's made a huge difference in maternal and child health,
Huge.
but its impact goes so much further.
Oh, absolutely.
The NHM has been taking on some of India's biggest health challenges,
Some tough ones.
like tuberculosis,
TB has been a problem
for centuries.
for centuries. But under the NHM, we're finally seeing real progress.
That's so encouraging.
Between 2015 and 2023,
Okay.
the incidence of TB went down
Was down how much?
from 237 to 195 cases
Hurt.
per 100,000 people.
And what about the mortality rate?
Even more importantly, that went down too,
Okay.
from 28 to 22.
Per 100,000.
There are 100,000 people during that same time.
Those numbers are looking good.
They are.
What's behind this success?
Well, it's not just luck.
I didn't think so.
The NHM has this multi-pronged strategy.
To fight TB.
Yes, and it includes early detection and diagnosis,
Okay.
more effective treatments,
Right.
and they've got these big awareness campaigns.
To teach people about the disease.
How to prevent it from spreading.
It's working.
It's paying off.
So the NHM is all about being proactive.
Proactive, not reactive.
That's good.
And it's not just TB.
Oh, really?
They've also been making progress with malaria
Okay.
and Kala-Azar.
Those are two big ones,
Two diseases that have been a real burden on India.
historically.
Yes, and the success in controlling them
Yeah.
really shows the NHM's dedication to
Dude.
reaching everyone,
Even those underserved communities?
even the most remote ones.
But their achievements go beyond that.
Oh, they do.
Let's talk about vaccinations.
Vaccination's a cornerstone of public health.
I know India's been doing some big things with their vaccination drives.
Huge drives.
Tell me about it.
The NHM's vaccination programs have been amazing,
Okay.
especially the measles rubella elimination campaign.
Wow.
Under the intensified mission Indrahanush 5.0,
5.0.
they got incredible coverage.
How much are we talking?
97.98%.
Wow.
They vaccinated 34.77 crore children.
That's a lot of kids.
It is.
Protected from those diseases.
Those are some serious diseases.
It really shows what a good public health campaign can do.
It does.
And speaking of big campaigns,
Yes.
we can't forget about India's COVID-19 response.
That was huge.
What did the NHM do?
They played a key role.
Okay.
They gave over 220 crore vaccine doses between January 2021 and March 2024. And along with that, they implemented the India COVID-19 Emergency Response and Health Systems Preparedness Package.
ECRP.
ECRP shows the NHM can adapt
Yeah.
and respond to emergencies.
So they're not just about long-term plans.
They can think on their feet.
They're like healthcare superheroes.
Always ready.
we've been talking about these large-scale programs.
Right.
But the NHM has all these specialized initiatives, too,
So many.
for specific health challenges.
Very specific.
Can you give us an example?
Of course, one that comes to mind is the Pradhan Mantri TB Mukt Bharat Abhiyan.
What does that mean?
It means Prime Minister's TB-Free India campaign.
Oh, wow.
It was launched in 2022.
Okay.
And the goal is to eliminate TB
From India.
by 2025.
That's ambitious.
It is, but what's unique about this program
Yeah.
is that it really focuses on community involvement.
I like that.
They
How
have
do they do that?
They've got over 1.56 lakh volunteers.
What are they called?
They're called Nikshay Mitras,
Nikshay Mitras.
and they provide nutritional and emotional support to over 9.4 lakh TB patients.
Across the country.
All over the country, it shows how important community participation is.
For reaching public health goals.
Absolutely.
It's like a whole support network.
It is.
For TB patients.
Helping them through their treatment and reducing stigma.
That's fantastic. What other programs are there?
Another important one is the Pradhan Mantri National Dialysis Program.
PMNDP.
PMNDP. It gives affordable dialysis services to patients with kidney failure.
That can be really expensive.
It can be financially crippling.
So what kind of numbers are we looking at?
Just in the last fiscal year,
Okay.
over 62.35 lakh hemodialysis sessions were given
How many patients?
to 4.53 lakh patients.
That's amazing.
It's life-saving work.
Access to affordable dialysis can really make a difference.
It can.
Are there any other specialized initiatives you want to talk about?
Yes. There's the National Sickle Cell Anemia Elimination Mission.
When did that start?
Launched in 2023, it focuses on screening and managing sickle cell anemia.
Which is...
It's a genetic disorder that's common in tribal areas.
And they've
already screened over 2.61 crore people.
in those areas?
Early detection is key.
It sounds like the NHM is doing everything it can
They are.
to improve the health and well-being of all Indians.
For everyone.
But all this takes resources.
It does.
Money, infrastructure, technology.
All of it.
How's the NHM handling that?
That's a great question, and it brings us to another interesting part of the NHM.
Which is?
Their use of technology.
Oh.
One example is the UW Wine platform.
Tell me about it.
It was launched in January 2023
Okay.
to track vaccinations in real time.
That's smart.
It's incredibly valuable for transparency and accountability.
Is it used everywhere?
It's still being rolled out.
Okay.
But by the end of the 2023-24 fiscal year, it was already in 65 districts.
So they're really embracing technology.
They are.
So it's not just about buildings and equipment.
It's about using technology
to improve healthcare.
To make things more efficient.
What other ways are they investing in infrastructure and technology?
Well, they've been working on certifying public health facilities
Under
the National Quality Assurance Standards.
NQAS.
NQAS, and make sure those facilities meet certain standards.
Which improves the patient experience.
Exactly. So far, 7,998 facilities have gotten NQAS certification.
That's a lot.
It is.
What about access to healthcare?
Especially in remote areas.
Yeah. How are they doing that?
They've been increasing the number of Ayushman Arogya Mandir centers,
Which offer
all sorts of essential healthcare services.
And how many are there now?
There are 1,072,148 centers, and 1,034,650 of those are giving 12 key services.
What about the really hard-to-reach areas?
The really remote ones.
Yeah, far from any town or city.
They've been expanding 247 services in primary health centers and first referral units.
So healthcare is available when people need it.
Exactly. 12,348 PHCs and 3,133 FRUs offer round-the-clock services now.
Wow. And for the most remote areas?
They've got mobile medical units.
MMUs.
MMUs, they're literally taking healthcare on the road.
Bringing it right to the people.
Right to them. There are 1,424 MMUs running now.
How do they manage all those?
They have the MMU portal.
When was that launched?
2023, it tracks and manages all the units.
That's another good example.
Of using technology to improve healthcare.
The NHM is really something.
It is.
It's constantly changing and adapting.
To meet India's needs.
But it can't be all smooth sailing.
Oh, there are challenges.
There have to be hurdles.
Nothing this big is easy.
Understanding these challenges is important.
Very important for your UPSC prep.
So let's talk about those challenges.
Let's do it.
What are some of the biggest hurdles?
Well, one of the biggest is dealing with the differences in healthcare access and quality.
In different areas?
Different regions and socioeconomic groups.
So even though the NHM aims for universal health care coverage
There are still gaps
for certain communities.
for marginalized communities and those in remote areas
This is a key point for our listeners.
studying for their exams.
It's not just about knowing what the NHM does.
It's about analyzing its weaknesses.
And really understanding healthcare in India.
It's complex.
Besides location, what other challenges are there?
Another big one is having enough skilled healthcare workers.
Especially in those rural areas.
It's hard to attract and keep qualified doctors and nurses.
Yeah, you have to make it appealing.
Appealing and sustainable.
And of course, there's always the issue of funding,
Funding is crucial.
even with the best plans and ideas.
If you don't have the money, it's not going to work.
The demand for healthcare is always growing.
It is. And finding the resources to meet that demand,
It's tough.
it's a constant challenge.
It's not just about the amount of money either.
Right.
It's about how it's used.
Transparency, accountability, efficiency.
All of that is essential for the NHM to succeed.
Absolutely.
The NHM's journey has its ups and downs,
It does.
but its dedication to innovation and its focus on community participation
It gives us hope
for a healthier India.
for everyone
For our listeners, the NHM is a great example.
of how complex healthcare is.
And public health and governance and social development.
All in India.
Let's take a minute to think about all this.
Take a minute.
And then we'll come back for our last segment.
Our last segment.
We'll talk about how the NHM fits into India's development goals.
And its global commitments.
I don't go anywhere.
We'll be right back.
Okay, we've talked about a lot with the National Health Mission. Their achievements, their initiatives, the challenges they face.
It's a lot to take in.
Yeah, but let's zoom out for a sec.
Okay.
Big picture time.
All right.
How does the NHM fit into India's overall development goals?
That's a great question, and one that UPSC examiners love.
Oh, yeah?
The NHM isn't just about healthcare on its own.
Right?
It's a key part of India's socioeconomic progress.
I can see that a healthy population is a productive population.
You got it. When people have access to good healthcare,
Yeah.
it affects everything.
Like what?
It helps with education.
Because healthy kids can go to school.
Exactly. They can learn better.
Right.
It creates more economic opportunities.
Because a healthy workforce is a more productive workforce.
And it even helps people get out of poverty.
Break free from that cycle.
So the NHM is doing more than just treating diseases
It's building a foundation
for a better India.
a stronger, more prosperous India.
And that connection between health and development.
That's a key theme for your UPSC exam.
Okay, good to know.
For example, the NHM focuses on maternal and child health.
And that directly impacts India's demographic dividend.
So a healthy and educated younger generation is important.
It's essential for growth and innovation.
It's investing in the future.
Exactly. And a healthier population also puts less strain on the healthcare system
Makes
and
sense.
frees up resources for other things.
Now let's talk about India and the UN Sustainable Development Goals.
The SDGs.
How does the NHM contribute to that?
It plays a big role.
We already mentioned SDG 3
Good health and well-being.
and how India is on track to meet those targets.
For maternal, child, and infant mortality.
It shows India's commitment to global health.
And their leadership in tackling these health challenges.
But the NHM does more than just SDG 3, right? Its impact goes beyond that.
How so?
By addressing poverty, improving sanitation, promoting gender equality.
Through all their different programs.
The NHM indirectly helps achieve other SDGs too.
It's like a ripple effect.
It is one thing leads to another.
When we invest in health, we're making progress everywhere.
That's the idea.
It's all connected. That's important to understand for the UPSC exams.
So when you think about the NHM,
Don't just think about healthcare.
think bigger.
Economic growth, social justice, environmental sustainability, India's place in the world.
The UPSC exams aren't just about what you know.
It's about how you think.
Connecting the dots, seeing the big picture.
Analyzing complex issues like the NHM.
Now, before we finish up, I
Yeah.
have a question for our listeners.
Okay, sure.
We've talked about all this progress, but there are still health inequities in India.
There are.
What can we do to fix that?
What new approaches can we use
Beyond the NHM.
to make sure everyone has access to health care?
That's a tough one.
It makes us think outside the box.
To imagine new solutions.
What role can technology play?
What about community engagement?
Even behavioral changes.
How can we create a fairer healthcare system?
For everyone in India.
That's what we hope this deep dive has done.
Inspired you.
To think critically, to ask questions.
And to keep learning about India's healthcare system.
Because the NHM is more than just a government program.
It's about taking care of people.
It shows India's commitment to its people.
To their health and well-being.
So for all you future civil servants out there,
Remember,
understanding the NHM isn't just for the exams.
It's about making a difference.
in the lives of millions.
That's what public service is all about.
Using what you know to create a better India.
A healthier, more equitable, more prosperous India for everyone.
And if you liked this deep dive,
Hit that subscribe button.
and share it with your friends.
We'll be back with more deep dives
But important topics.
to help you ace those exams.
Until then, happy studying. Good luck on your UPSC journey.
Then remember,
All the information we've talked about.
can be found on the Press Information Bureau website.
Your source for all things government and policy.